Hello, everyone. In this episode, we're going to talk a little bit about the anatomy of the chest and the abdomen. We'll take a look at a heart as well, and we'll see how that actually sits in the chest. So if you look closely here, what you can see inside is a beating heart, and that heart is sitting in an area called the mediastinum or the mediastinum, depends on how you like to pronounce that. Now, if I go in and I pull that heart out, okay, you can see that the heart actually is slightly tilted towards the left-hand side, so the apex of the heart points a little bit towards the left side of the rib cage. Okay, I'm going to pull this heart away, and I'm going to pull forward the internal anatomy. This is the anatomy of both the chest and of the abdomen. What you're seeing up here are the lungs, so this is the right lung and the left lung, all right? And I can actually place it on myself as to approximately where it would be, along with the heart as well. And the heart sits right in the middle there in the mediastinum or mediastinum. Okay. So what we've got coming down here, this tube that's coming down, is actually the esophagus. The trachea is not represented here, but the trachea would run just in front of the esophagus. What we've got right here, this sort of little, almost looks like a little mushroom. This right here is the diaphragm, and the diaphragm is that muscle that contracts down in order to get us to breathe. The lungs don't really have musculature inside of them that causes them to expand and contract. That's the job of the diaphragm. So if you look just under the diaphragm right here, this sort of dark magenta colored organ, that's your liver. And the liver sits mostly on the right-hand side with a little part of the liver coming over the stomach onto the left-hand side here. And the stomach is this structure right here. So here's our stomach. Okay. This, of course, is the large intestine with the appendix right there at the bottom. This is the large intestine all the way around, and then the colon and rectum would be down here. This is our small intestine. Small intestine weaves its way in through there. Holding this all together and not represented here is the mesentery. We're going to turn this around and we're going to take a look at the back here. And if you look at the back, what you'll see is these two little structures here. Those are your kidneys. Those are your kidneys. And then coming down here are the ureters. And that's leading out to the bladder, which also is not represented in this model. So those are the two kidneys right there. And if you look very closely, grab that, on top of the kidneys there are little hats, little hat-looking things. And those are the adrenal glands. Those are the adrenal glands. That's where the primary hormonal drivers are going to be for the sympathetic nervous system, your epinephrine and your norepinephrine. Okay? We'll turn this back around. Oops, grabbed a heart. Oh, look out. Put that heart back over there. We'll turn this back around and we'll put that back into the body just like that. Okay, and then we'll grab our half heart, and our half heart is going to go in there like this. And before I put that back, I just want to show sort of how this flows, right? So blood flow returning from the body goes into our inferior vena cava and into our right atria, which is this right here. Blood flow from the head comes down through the superior vena cava and goes into the right atria here as well, okay? And then that blood goes down through this valve right here, and that valve right there is called the tricuspid valve. And you'll notice these little cords that seem to be holding it together. Those are called the chordae tendineae. The blood comes down into the right the right ventricle here from the right atria, and then back out through this valve right here. This valve is called the pulmonic valve. That pulmonic valve then directs the blood flow out through the pulmonary arteries and to our lungs, and then the return blood comes back from the lungs and goes into the pulmonary veins, which then empty into the left atria right over here. That left atria, then the blood flows down through this valve here called the bicuspid valve, And from that bicuspid valve, it then goes out through the aortic valve, which is a little hard to see. You have to look right inside the heart there. That aortic valve then pumps the blood back out to the body. So if I step over to this heart right here, this heart right here, and I'm actually going to get behind our whole heart. This whole heart right here, that aortic arch that's coming off of here, this is the aortic arch right here. And this first branch off of the aortic arch, this is called the brachiocephalic artery. That brachiocephalic artery will branch out again and become the right subclavian artery, which will go this way, and it'll become the right carotid artery, which will go up to our head. This middle branch right here, that's actually the left carotid artery, which would come up on the left side of our head. And then this branch right here, this is the left subclavian artery, which goes out and down our arm to become the brachial artery. Okay. And if you look at the exterior portion of this heart, what you're seeing on the outside here, this right here, this is the left anterior descending artery. This is the primary feeder of the left ventricle, very important artery. Over here on the right side is the right coronary artery. That right coronary artery comes down and feeds the right ventricle. And then if I go around over here underneath that left atria, what I'm going to see is another artery that's going to come and embed itself in the back of the heart, and that is the circumflex artery. Some people call it the left circumflex artery. I just call it the circumflex artery because there's no right circumflex artery. And so that's the general anatomy of the heart and of the chest. And I welcome you to watch a few more of my videos here in virtual reality, and I thank you for your time.